Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, as well as the Medical Officer of Health at the Middlesex-London Health Unit and London Health Sciences Centre's Executive Vice President, Chief Clinical Officer and Chief Nursing Officer, Carol Young-Ritchie. Welcome to the media in attendance this afternoon as well. We do remind you that if you would like to submit a question, you can do so. Just click on the text bubble with the question mark in it here on Microsoft Teams. And if you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome to those folks attending this afternoon by watching on Rogers Television or the Rogers Facebook page and YouTube channel. Listeners on Global News Radio, 980 CFPL, and those who are watching on the CTV London website. Let's get to our opening remarks, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. You know, our healthcare heroes need our support today more than ever, especially with a series of planned protests by anti-vax mobs outside hospitals across Canada today, and that includes LHSC. You know, it's an absolutely disgraceful development, and one I condemn in the strongest possible terms. Look, our healthcare heroes are stressed enough already, which to say nothing of the innocent, vulnerable patients who are just seeking comfort and treatment. I say to those mindless mobs, how dare you? Leave our health professionals alone, because harassing them accomplishes nothing. I've spoken with members of the London Police Service who have assured me they will be on site at LHSC to monitor activity and enforce the law while ensuring staff and patients will not have their movements impeded nor delayed. Anyone who attempts to do so will be dealt with appropriately and should be. The ultimate irony is when members of this ignorant mob inevitably become sick with COVID in the coming days or weeks or months, it's the people they're harassing, the doctors, the nurses, the hospital staff, the same people who will treat them with kindness and compassion and professionalism. It'd be nice if those courtesies were a two-way street. To those who work in healthcare, to those who remain on the front lines, treating, protecting, and caring for all Londoners, including those who seek to undermine those efforts, you are the best among us. We celebrate and value you always. On another note, and equally disturbing, we had a tragic and devastating weekend at Western University. This is incredibly serious. There are multiple allegations of sexual assaults in residence. A young man was killed in a fight near campus, while crowds were once again out of control on Roughdale in the university area, throwing bottles at first responders. What the hell are they thinking? None of this is okay, and it can't be swept underground or ignored. I've spoken today with the police and with Western's President Alan Shepard, and I've made my feelings clear. Like I said, this was nothing less than a devastating weekend. I'm confident that with investigations underway, it's important to allow investigations to play out before jumping to broad conclusions. However, this type of behavior will absolutely not be tolerated. There will be consequences, and there are consequences. We not only expect better, we should demand better. You know, no excuses like pent-up party demand due to COVID is acceptable. I say to those students, grow up. You're at Western to get a higher education, not get stupid. So it's truly important at this point in time, and as we get closer to homecoming, that that all responsible people, which is almost everybody, including those at Western, that we get it. And to those who choose to break the law, to those who choose to be absolutely ridiculous, I'll put you on notice now. We are going to ensure that your behavior is stopped. Over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. Really want to say how much the comments about those hospital protests are appreciated. It's truly disturbing to see this trend, although I understand it is still a very small number of people involved. You know, healthcare workers are, many of us, at the end of our ropes, and it's been a difficult year and a half, and we've had tremendous support from yourself, Mr. Mayor, and across our whole community. Really grateful for that, and it's disheartening to see this turn of events. On the COVID front, things are moving in the right direction. we have really leveled off locally and provincially. It's clear that the vaccine campaign and the mandatory vaccination policies, which are getting sort of that last 10 to 15% of people vaccinated, are making a difference. It's pretty unique right now anywhere in the world to see a fourth wave that is plateauing without substantive public health measure interventions on top of vaccine campaigns. Our community and our country has among the highest vaccination rates in the world right now. That is making a difference, and it's really moving in the positive way from a public health perspective to see that happening. The vaccine campaign does continue. We had 300 additional walk-in per day, roughly, over the last week or so. At the Agriplex, we've had 200 to 300 people per day. At our Masonville clinic, lots of other activities at the pop-up clinic. Media will have in their inboxes a release that came out moments ago. We're very excited that we're moving the mobile clinic that had been in Masonville over to White Oaks Mall. That's a community that's been underserved, under-vaccinated, and has had fairly high rates of COVID related to the surrounding areas. So very grateful to the leadership at White Oaks Mall who have allowed our team to take up a position in their mall starting today and for at least the next week, potentially longer. The first shopping mall clinic that we had at Masonville over the 2 weeks had over 2,500 doses, and more than half of those, just 52% of those, were first-time doses. So very happy with that progress. And again, a clientele that isn't necessarily coming to the mass clinics. So thank you to everyone who was involved in setting those clinics up, to the organizations that hosted Masonville and now White Oaks, and of course to everybody that came down to roll up their sleeves. And I'm happy to pass to Carol Young-Ritchie for perspective from LHSC.
Great, thank you. Good afternoon, everyone, and thanks for inviting me here today again to speak on an update of COVID-19 situation at London Health Sciences Centre. As of this morning, we are caring for 7 COVID-19 positive inpatients, with fewer than 5 of those being in critical care. We are also caring for fewer than 5 in our children's hospital. It's unfortunate, as I speak to you right now, there is a protest occurring outside of Victoria Hospital. We respect everyone's right to freedom of speech, but we disagree fundamentally with the position and the approach taken by these demonstrations and where they're being held. While this is being promoted by the organizers as a silent vigil, we cannot ignore how vocal the past protest was and the negativity directed towards our providers and patients. LHSC leadership is working to ensure a safe and supportive environment during this time. We have met with the London Police Services to ensure support and awareness of our hospital grounds, connected with the emergency management for the City of London for awareness, and we continue to closely monitor the situation throughout the day. Our staff and physicians have been working tirelessly for 18 months in full PPE to respond to the needs of our community since the pandemic began. When we were experiencing short breaks in the wave, we've adapted and worked hard, just as hard, to care for the non-COVID needs in our community. As stated by the Ontario Hospital Association, and I quote, "It's a bitter irony that should any of these anti-vaccine protesters get sick or seriously ill from COVID, you will be the hospital and the frontline workers they turn to for care, and perhaps even to save their life." We know coming to the hospital can be already a stressful experience for our patients. They, like our staff, deserve to come to the hospital to receive care in peace and safety. Lastly, we know that we are already in the 4th wave of COVID-19. If you have not done so, we implore you to receive your vaccination. In addition, following the public health guidelines, including masking, hand washing, and physical distancing. We strongly believe that adding vaccination to our many other protective measures is the right thing to do to protect us all. Thank you.
And thank you, Carol Young-Ritchie, Dr. Chris Mackie, and Mayor Holder. We do have some questions in the queue, so let's get to those right away. And we'll start with a question from Jane Sims of the London Free Press for Dr. Mackie. Dr. Mackie, today's health unit dashboard suggests that half the people who have died from COVID-19 in the past 6 weeks were fully vaccinated. Can you give us more details about this?
I sure can, Jane, and really appreciate you asking. First of all, I can tell you that we have a data issue that is being addressed as we speak. It's not correct. The issue was that in the spreadsheet that tracks these cases, the cases were so there are two different dates. There are the episode date, which is when the symptoms started. Well, there are 3 dates. The episode date, you've got the date of diagnosis, which, it takes some time between symptoms, getting tested, getting results back, usually a couple of days at this point. And then you've also got the date of the death. When we updated the dashboard last week, the script that was written to do that, unfortunately, accidentally took the episode date as if it were the death date. So so what ends up happening when you analyze that way, which isn't actually very meaningful, but there have only been 2 of those deaths that have episode dates within the past 6 weeks. The other deaths had episode dates, so it became sick sooner. What this means is that 1 out of 2 of those people was completely unvaccinated. Unfortunately, this 80-plus-year-old woman who was double vaccinated has passed, and obviously tragic, but it isn't a signal about vaccine effectiveness, and the stat about 50% unfortunately is not correct. We'll get that corrected as soon as we can for you, Jane.
Thank you very much, Dr. Mackie. Let's go to our next question. It's a follow-up from Jane Sims. And Jane asks, Dr. Mackie, with less than 14 days to go before the vaccine certificate program is about to kick in, how many more unvaccinated or partially vaccinated people are showing up for their shots? And I know you mentioned in your opening remarks that things have been going very well at the clinic based at Masonville Place, for instance.
That's for sure. The clinics, turns out, when shopping malls are open and people are going through, it is a fantastic place to vaccinate. So that's going great. We also are seeing at the Agriplex, which LHSC runs, lots of first-timers coming in. It's in the range of half of the people who are coming to the clinics, and that's a real positive. We don't have this week's statistics. We get those Tuesday, so we'll update our dashboard tomorrow around midday with the new coverage rates. We had been, last week we saw an increase in total first doses by about 1.2% of our entire population. That's actually quite positive. That's what we were doing, a month or more ago. And to see the numbers back up to that level is very encouraging. Hopefully that continues over the next few weeks and we can get up to 90%.
Thank you very much, Dr. Mackie. The next question is from Jacqueline LaBelle at Global News Radio 980 CFPL. Dr. Mackie, Jacqueline asks, the first week of school is in the books, and there are cases at a handful of schools in the region so far. How do you feel about how the first week went, and what are you anticipating going forward from a pandemic perspective?
For sure, Jacqueline. Thanks for the question. So, when schools open, you see more testing of young people because of that mandatory testing component of school. And so you do see cases crop up. It's too early for any of the cases detected to be related to transmission in school. It's possible that we've had some transmission in school at this point, but it wouldn't show up in the statistics from today. Maybe tomorrow, but more likely, later this week or next week. So we don't know at all about whether there has been any transmission in schools. The numbers that we are seeing in terms of school cases, it's less than 5. It's quite understandable in terms of where we're at and the spread of COVID. Unfortunately, the children are the largest unvaccinated population. And so we know that with the Delta variant, it spreads first among unvaccinated people. And that is, so it's no surprise that we're seeing a handful of cases in schools at this point. What are we anticipating going forward? Well, That's really up in the air. It has a lot to do with how many adults get vaccinated and whether we are able to protect the children that we're in contact with as adults. And if we have a strong vaccination campaign among adults, it'll do a very good job of protecting the children. And of course, as we saw in previous terms, there is likely to be a small amount of spread in schools, and we'll get on top of that and work with school boards as we do to try and address any issues that do come up.
Thank you very much, Dr. Mackie. And we do have a few questions left in the queue. So I am going to take this opportunity to remind members of the media who are joining us for today's briefing that if you've been waiting on a question, now would be the time to put that question in. Again, if you're joining us for the first time or you haven't submitted a question before, just click on the text bubble with the question mark in it. And if you could indicate your name as well as your media outlet and who your question is for. Next question, Dr. Mackie, is for you, and this is related to your previous question. Sophia Rodriguez at CBC London is joining us. Dr. Mackie, can we expect to see more cases in school settings? What do you say to parents who are fearful of continuing to send their children to school because of COVID transmission? What would it take to close down schools again?
Well, Sophia, I don't think we're anywhere near that. What I'm hearing more from parents is that they're afraid that schools might close down again. And I'm hearing that from a lot of parents. And I mean, I am a parent. Of course, I'm feeling that as well. I don't think we're going to see that in the short term. It would be quite a blow for families. I know the government is aware of how important it is to have in-person learning, and that's the signals that they've been sending. What we did see last year, we did not see any schools closed because of outbreaks last year. We did not have any significant outbreaks that would have closed schools. What we did have last year was we had situations where one student or staff person had been in close contact with a number of staff at the school, which ended up meaning that the schools had to close for logistical reasons because they couldn't staff for a short period of time while people got tested and contacts got cleared. So I think that's certainly possible. I hope and believe that we will not need to close the whole school system this year.
Thank you very much, Dr. Mackie. And let's go to our next question. Mayor Holder, this question is for you, and it's in connection with your opening remarks for this afternoon's briefing. And it comes to us from Casey Taylor at 570 News in Kitchener. Mayor Holder, with respect to the allegations of drugging and sexual assault at Western, letting investigations play out is one thing, but the numbers being suggested are shocking and horrifying. Does your message to any students involved in this type of activity stop at grow up? And what is your take on the tone of the message from Western itself responding to these allegations compared to the stiff and strong statement after move-in weekend parties threatening an end to in-person learning? And I'll just add here, Casey, one of the things you might want to do, of course, is reach out to Western on this. But Mayor Holder, the question is for you, so I'll turn it over to you. Mayor Holder, I'm sorry, I think your microphone may be on mute.
Is it clear now, Dan?
It is, yes, sir.
Thanks. Casey, I think you're from Kitchener. If you know me at all, you will know the strong position that I have been consistently taking on a number of issues around COVID. If you were paying mind to what I said in relation to the reference to grow up, it was those imbecile drinking students who thought it'd be really clever to bottle the cops and the first responders. Conduct that is absolutely bizarre and ridiculous. That's what I was talking about when I made reference to grow up. You and I clearly know issues around allegations of drugging and sexual assault. That's of a degree of the highest order, and frankly, unacceptable anywhere. I cannot imagine what the individuals who have been impacted are going through. But I would say this, and that I can't comment firstly on Western's tone of their messaging. As Dan has said, you'll have to talk to them. But what I'll say is that the investigations have to take their course, and people are encouraged to come forward to assist in the investigations. I think that's truly important so that we can deal with these individuals in the strongest possible terms. When I have spoken to the president of Western Eden, particularly today, there's two parts. One is sexual assaults are absolutely a criminal offense and would be dealt with in part by the police and in a large part by the police. The other part, the part that Western can control, is the issues around expulsions. And I would expect absolutely in some of the conduct that you have seen over this past weekend that expulsions will be the order of the day in a number of cases. And I would expect that, and I think absolutely justified. But when it comes to the issues around allegations of drugging and a sexual assault, there's no more heinous a crime. And frankly, we should be dealt with as in the highest possible order and absolutely not tolerated by this society, this city, nor Maine.
Thank you very much, Mayor Holder. We do have one more question in the queue. So before we get to that, I do want to draw the media's attention to something Dr. Mackie mentioned earlier in today's briefing, and that is a media release issued by the health unit just before we got underway today. And this is an announcement that, and Dr. Mackie spoke to it as well in his remarks, that the health unit will be opening its next retail shopping mall-based vaccination clinic tomorrow. That gets underway at 11 a.m. at White Oaks Mall. So if there were any questions about that, now would be a good time to put those into the chat. All right, let's go to the next question. Ryan Payet joins us today from the London Free Press. Dr. Mackie, the Thames Valley District School Board is getting some pushback on the timing of its mandate that all participants must be double vaccinated before taking part in high school sports, which can resume practices today. At this point, how important do you view this mandate in getting more teenagers vaccinated? And in your opinion, is 2 to 3 days notice enough warning?
Yeah, thanks for the question, Ryan. I need to be really clear. Mandatory vaccination policy has a positive impact on vaccination rates, but it is primarily to make sure that environments are safe. So, the health unit did support school board's decision to implement this sort of policy, but not because we need to see vaccination rates higher in teenagers. We do, and we're addressing that through other means like school-based vaccine clinics. This is a safety issue. If students are going to be involved in sports, they're going to be closer contact, more physical activity. That means more respiration and more droplets being produced and spread potentially. And potentially even, if physical contact, even if accidental, as part of their practices and in the games. So, if students are going to engage in these discretionary activities, then the bar for vaccination needs to be that much higher in order to keep the students safe. And that is the focus. And yes, I believe it is necessary for that.
Thank you very much, Dr. Mackie. And let's go to, well, that actually does do it for our questions for today's virtual media briefing. So to all the members of the media who joined us, thank you for your questions. Thank you for your attention. Mayor Holder, Carol Young-Ritchie, Dr. Chris Mackie, thank you for your time and for your insights and information as well this afternoon. That does do it for us for today. We will be back with our next virtual media briefing Thursday afternoon at 2 p.m. We hope you'll join us then. So between now and Thursday afternoon, have a great rest of your Monday. Take care, and so long for now.